people think that if you treat ADHD with medication, then you're paving the way for drug use, and which is totally a misconception. It's a myth, because if anything, treating ADHD reduces the chances of the person dabbling into substances, because as I mentioned before, their brain is looking for something and they're prone to kind of self-medicate, and if they're not treated, the moment they discover that substance, they're going to get hooked on it, and that substance is not going to treat the problem. It's going to be just a band-aid, but it will have its own baggage, right? Especially for the developing brain. Another one that comes to my mind is that sometimes people will say that if you treat ADHD with medication, well, how are they going to learn how to manage it? So the way I, invite people to look at medication is the analogy of a scaffolding. Just like to build a building, we need scaffolding, right? And we take the scaffolding off when we don't need it. Similarly, the brain, because it is developing, and we talked about it being a neurodevelopmental disorder, so therefore it requires certain types of scaffolding. So the medication is in fact, just a scaffolding to provide the brain a chance to develop at a relatively normal pace, right? And once that is achieved, there is a likelihood that the medication can be taken off, because they're not addictive.